Hello, everyone. Thank you for joining us today. My name is Jacqueline Ventura. I'm a community health worker for the Partnership for Maternal and Child Health. And as a community health worker, I have been working with people who have been thinking about getting vaccinated against COVID-19. Today, we will be speaking about the importance of the COVID-19 vaccine during pregnancy. Joining us today is Shalika Morgan and Dani Canales. Thank you for being here. Shalika, if you could please introduce yourself.
Hi, my name is Shalika Morgan. I am a nurse home visitor with the Partnership for Maternal and Child Health of Northern New Jersey, and I work for the Nurse Family Partnership, who services Bergen and Passaic counties.
And Dani, if you could please give us a little introduction, if you can.
Hi, yes. So I'm Dani. I currently have a 3-month-old. I'm a stay-at-home mom.
Perfect. Thank you for being here.
Thank you.
Okay, let's begin. Shalika, we know that the information about COVID-19 is changing constantly. So it's understandable that expecting mothers may be confused about whether to get vaccinated. We wanted to know, is the vaccine safe for pregnant women or those who are wishing to become pregnant?
Yes, the COVID-19 vaccine is very safe for women to receive, women who are pregnant, who are thinking about becoming pregnant, and women who are breastfeeding.
Perfect. The pregnancy is also a special time for expecting parents, but it can also bring a lot of anxiety. You have a lot of things going on when you become pregnant. How do you talk to the moms that you work with about getting vaccinated to assure them that the vaccines are safe?
Well, the first thing I do is to ask them what they know about the vaccine. And then after they tell me what they do know about the vaccine, then that's when I go into talking about the truthful things that they've heard about the vaccine to make them feel comfortable about actually making the decision to receive the vaccination.
I agree, because I myself, working with the clients that I work with as a case worker, I have to tell my clients to speak to their healthcare providers, to the nurses, so that they can make the best decision that they possibly can regarding their pregnancy.
Absolutely, yes. That's the best advice to give, especially, for them to come to us as nurses when they have questions about vaccinations, and then also to refer them to their physicians, their doctors who's caring for them during that time.
Yes. Dani, you recently had a baby. Congratulations. You made the decision to get vaccinated against COVID-19. Could you explain to us why and how you came to the decision of getting vaccinated?
Right, yes. Thank you. So I did have some concerns. I was iffy about it in the beginning, I'm not gonna lie. It took me a while to decide, but when I decided, it was all about balancing the good and the bad. I had to see, like, okay, what was good, what was bad. I did have so many questions. I kept asking. I remember I asked Shalika. I asked my doctor multiple times. I did not get the vaccine until the 3rd trimester, but it was honestly the best choice that I made.
Perfect. Could you explain to us what the experience was like when you got vaccinated? How did you go about it?
So I remember I went to St. Joe's itself. They were having people go through the drive windows. I went. It was very, very quick. I filled out some paperwork, and they vaccinated me. I luckily did not have any symptoms. No fever, nothing like that. The only thing was that I had a little bit of a sore arm, but I still went to work that same day, the following day. So it was not bad at all.
So you could say that you didn't have any difficulties getting the vaccine?
Not at all, no, not whatsoever.
I also wanted to know if you're breastfeeding and if getting the vaccine affected the decision of breastfeeding after you got the vaccine.
So I did breastfeed, but that was after I got the vaccine. But honestly, like that wasn't a factor as to like why I should get the vaccine or not. Like I knew I was going to breastfeed regardless, but it did give me some ease knowing that I had the vaccine.
Perfect. Shalika, if you could please explain a little bit about what are the benefits of getting the vaccine and breastfeeding?
Okay. So the benefits of getting the vaccine and breastfeeding is that once a woman receives the vaccine, and the vaccine goes into her body, into her system, her body is making antibodies, which we know that when women are breastfeeding, the baby is actually receiving antibodies through the mother's breast milk. So in turn, the baby is actually getting the benefit of the COVID-19 vaccine through the mother's breast milk, which is great. So the baby has, some protection against it, because we know as of right now that babies or children under the age of 5 are not able to receive the vaccination at this time.
Perfect. We talk a lot about pregnancy and vaccines, but how important is it for the partner in the relationship or other people in the household to get vaccinated? Danny, if you could please tell me if you thought about those who live in your household, how important for everybody else to get vaccinated.
Yes. So luckily, everybody in my household had already gotten vaccinated, which to me it was very important because I had a newborn coming, and with them being vaccinated, it just put me more at ease. I knew that my newborn was going to come to a household where everyone was vaccinated, and God forbid something like, let's say my boyfriend would have gotten COVID. Some people would get really ill, so him being, especially getting the vaccine, it was honestly like it put me more at ease. I was like, okay, like I know if you do get it, you're gonna probably be okay, compared to you not having the vaccine and then God forbid something happening to you.
Shalika, how important is it for everybody else in the household to get also vaccinated?
It's very important for everyone else in the home to also get vaccinated, because it will kind of make a cocoon effect, so to speak, around the baby, because the baby cannot get the vaccine. So we're kind of cocooning, and everyone around the baby that has the vaccine can offer that protection to keep the virus away from the baby.
What advice would you both give to women who are pregnant or thinking about becoming pregnant and the COVID-19 vaccine? Shalika, if you could please start first.
Sure. My advice would be to get the vaccine to protect themselves, because pregnant women are at a more vulnerable state during the pregnancy, more susceptible to illnesses. So getting the vaccine will help to prevent them from getting COVID-19, as well as protecting their unborn child and protecting the baby when the baby is here with us.
Thank you. Danny, what advice would you give to women who are pregnant or thinking about becoming pregnant and getting the COVID-19 vaccine?
I would suggest for them to ask questions. Your healthcare providers, your doctors, they answer any question you have. If you have 100 questions, they sit down with you and they go through everything. So my advice would be to ask questions and then you go from there. I do recommend the vaccine. It was very beneficial to me, my newborn, and I was so happy to get it, honestly.
Thank you. Yes, I agree with you. I think having the conversation and asking as many questions as we possibly can assist you with making the best decision that you can for yourself and for your baby, as well as your family. To wrap everything up, I wanted to reiterate some of the points that we spoke about today. First, the COVID-19 vaccine is safe and effective for anyone who is trying to become or is pregnant. We also spoke about the benefits of getting the COVID-19 vaccine during or prior to pregnancy, which include lower hospitalizations, lower risk of complications, and increased immunity toward COVID-19 for the fetus. Lastly, the vaccine is easily accessible and has little to moderate side effects that go away quickly after administered. To get more information about COVID-19 vaccinations and pregnancy, please visit the CDC website and speak to your healthcare provider today. Thank you all for being here today. I think that's all we have. For more information about COVID-19 vaccinations and pregnancy, please visit the Partnership for Maternal and Child Health website. Thank you again.